Good morning. Today is March the 10th, and this is a work session of the Government Operations and Health Facilities Subcommittee of Health and Government Operations. Today we'll be taking up 10 bills, and the intent is to go through them in this order. HB 905, then we will take together HB 1324 and HB 765. Unless something changes, HB 106 will be held today, as I heard this morning from the advocates and sponsor that this bill has not yet been worked out. Fourth, we'll take up HB 991. Then we'll go to the big procurement bill, HB 500. We'll move on to HB 826, HB 761, HB 807, HB 855, and then HB 822. Okay. Since the chairman has not yet joined us, she wanted to be in for this HB 905. Aaron, can we go ahead and move to the pair of bills 1324 and 765, please?
Okay, yes. So there was discussion about merging both of these bills into House Bill 765. So there's a reprint that was provided. It's the most recent one to House Bill 765. It should be labeled Final Reprint 2. And this would incorporate the provisions of House Bill 1324 into House Bill 765. And that was kind of the agreement at the last subcommittee between the two bill sponsors. So I believe Delegate Spiegel is on the call, and I have provided this reprint of 765 to his staff, and they've reviewed it. So I'll just go over it, and then if they want to discuss any issues that they may have. So House Bill 765, as introduced, was an emergency bill that authorizes a hospital to sell debt owed by a patient for hospital services to a government unit or entity that is under contract with the unit for the sole purpose of canceling the debt. House Bill 1324 did the same exact thing, except it would allow a hospital to sell debt owed by a patient for hospital services to a nonprofit organization. In the reprint, you can see that on page 2, every year the hospital has to provide their policy on the collection of debts that are owed by patients, and they have to provide a report to the HSCRC. So the bill would provide that the annual report that each hospital is required to submit to the HSCRC for hospital debts owed by patients of the hospital that the hospital sold to a government unit, contract, or nonprofit organization, the total dollar amounts of the debt sold by the hospital for the reporting year, the total dollar amount paid to the hospital for the unit, contractor, or nonprofit organization who purchased the debt, and the total number of patients whose debt was sold in full or in part to the unit, contractor, or nonprofit organization. Then if you move on to page 3 of the bill, this is under the requirement that hospitals also have to submit their policy on collecting debts to the HSCRC. So that policy would have to include a requirement that they dismiss action pending against the patient for collective debt that's sold under subsection M of the bill, which we'll get to later, and prohibit the hospital from engaging in collection activities on 100% of the outstanding amount of the commission set charge for debt sold and collecting on judgments entered into on patient debt that was sold. Further on in the bill, it requires that a hospital may not report adverse information about a patient to a consumer reporting agency, commence a civil action against a patient for non-payment, or delegate collection activity to a debt collector if the hospital sold the debt per the requirements of the bill. So the meat of the bill is on page 5 of the reprint. And this provides that a hospital may sell debt owed to the hospital by a patient for hospital services to a governmental unit or entity that is under contract with the unit, or to a nonprofit organization that is exempt from taxation under 501c3 of the IRS code for the sole purpose of canceling the debt. The contract between the hospital and the government unit, contractor, or nonprofit organization purchasing the debt shall state that the sole purpose of the sale is to cancel the debt. The patient is not responsible to the hospital, government unit, contractor, or nonprofit organization for any amount of the debt that is sold or any interest, fees, or costs associated with the sale of the debt. And debt sold under this bill must be for hospital services provided at least 2 years before the date of the sale, may not be expected to yield additional reimbursements from a third-party payer, may not be subject to an open appeal with an insurance company, and must be for an individual whose family income is at or below 500% of the federal poverty level, or who has had medical debt exceeding 5% of the individual's family income as determined by the government unit, contractor, or nonprofit organization purchasing the debt. And then further on, there was talk about, if you go to the effective date, putting a 3-year sunset on the legislation. So there is a 3-year sunset provided. So it would take effect July 1st, 2025. I know Delegate Ivy's bill was an emergency bill, but I think that was a carryover from the Baltimore City bill, which was an emergency bill because of the ARPA funding. And then Delegate Spiegel's bill had an October 1st date. So I just kind of split it down the middle to a July 1st date with a 3-year sunset. There was one additional provision in Delegate Spiegel's bill that was not accounted for in the amendments. If you want to consider that in his bill, it provided that debt sold may not be subject to legal rights or contractual assignment limits that prevent the sale of the debt, including limits due to current liens or legal processes. And if that's agreeable to everyone to put in House Bill 765, I could add that in there as well.
Thank you. Delegate Spiegel. Good morning.
Good morning.
Anything else you'd like to add to the explanation of your bill?
I'm happy to answer any questions, Mr. Chair. I just want to thank the subcommittee for your work and your support of this idea to merge these two bills, which are very closely related, obviously, to ensure that the benefit of these multiple paths to relief of medical debt are available to consumers. I don't feel super strongly about that last provision that Ms. Hopwood mentioned. I'm happy to have it in the final version of the bill, but if you all are concerned that it might create some bureaucratic challenges or some legal challenges, that's the provision that says that even if a debtor has a lien, that the sale can still go through between the hospital and the buyer. Then I'm happy to answer some questions or talk about that, but I don't feel strongly one way or the other, whatever the subcommittee's preference is. And like I said, I'm happy to answer any questions, Mr. Chair. Thank you.
Thank you, Delegate. Okay, committee members.
Move the amendments for
Yeah,
discussion.
thank you. We have a motion on the amendments. And is that a second, Delegate Taveras? Okay, now discussion on the amendments. Delegate Hill.
Yes, thank you. Delegate Spiegel, can you just clarify? I mean, we were talking about ARPA funds when we were talking about selling it to a government agency. What kind of not-for-profits are we talking about that would be interested in doing this? And when we were talking about the ARPA funds, we also had the emergency date because they needed to spend those. So you can't answer the question about why the July date is good enough, but you can talk about the not-for-profit piece.
Sure. Thank you for the question, Delegate Hill. My version of the bill, or my bill before they were merged, the idea was that in the secondary market, I'm sure you know, a lot of these debts, which are not collectible or determined to not be collectible by hospitals, are really only worth pennies on the dollar. And so it's easy to leverage the resources, even of a small nonprofit, to purchase what is on paper a large amount of debt, even though they're only paying a very, very small fraction of the cost. There are a number of nonprofits that are engaged in this type of work. And at the bill hearing, we highlighted a nonprofit in DC called SEDEC, which actually did this in Washington, DC, and for something on the order of $900,000 was able to purchase and cancel something like $42 million in debt for tens of thousands of residents of Washington, D.C. So there are nonprofits that are doing this work in the space, and they're able to leverage a relatively small amount of money to purchase and cancel a large amount of debt.
Okay, And just the follow-up, you said you don't particularly care about the provision that we may or may not add. And does SEDC and groups like that, is that a problem for them if there's a lien?
I'm not sure I can speak for Tzedek on that particular issue. The reason that was put into our bill was the concern that there might be some language in legal documentation between a patient and a hospital when a patient comes in for a procedure that might require the patient's approval to assign their debt to somebody else. And we wanted to avoid the concern that a hospital would have to try to track down each individual patient to sign off on the sale of debt in bulk to a nonprofit or to a government for purposes of cancellation in bulk. So that was the idea there. But I'm sorry, I don't know the
Okay.
position of Zedek in particular on that one.
Right. Thank you, Mr. Chair. Can we just ask Lindsay if she thinks that adding that provision creates, I mean, Aaron, rather, if she thinks that, hey, Aaron, sorry, if she thinks that that complicates things in any way?
At this point, I'd advise not including it. I think it's better safe than sorry.
Okay,
Thank you.
thank you. Delegate Taveras. Okay, still muted. You just took your hand down, but you didn't. There you go.
Sorry about that. I just want to make sure I understand the repercussions of what we're talking about here. So if Delegate Spiegel, so if a nonprofit or local government or entity purchase this, what's they're leveraging to do what? And then what's the implication on hospitals being able to lose $42 million, let's say? I just want to make sure that I'm clear the
Thank you.
impact that that would have.
Thank you, Delegate Taveras, for that question. I'll try my best to represent Delegate Ivy's bill as well. But the idea here is, as explicitly stated in both bills, or in the merged version of the bills that you all have, the only reason that this debt can be transferred is for the sole purpose of canceling it. That's it. It's very explicit in the bill. So it's not like it could be sold for the purpose of, going to some third-party collections agent that's going to knock on the door of a medical debtor. So it's very, very explicit about that. So I think that's important to understand. That's the only reason that this debt would be transferred. And then the hospitals, the only reason they would really tend to want to sell this debt is because it's uncollectible. And they know it's uncollectible. It's been deemed what we sometimes call pejoratively bad debt. So they're not going to lose out on that 42 million in DC. It's not collectible. So by getting it off their books, they sort of clean their books up a little bit as a hospital. They know that this debt is not collectible. And because they know it's not collectible, it's not worth much to them. And so in this sort of secondary market, the hospital can go to a nonprofit or they can go to a local government that's willing to spend some money on this. And the local government can say, all right, this is $42 million of debt, but we'll buy it from you for $800,000 or $900,000 and call it a day. And then they will take possession of the debt and cancel it. So that's how this works. And so it's much, much cheaper than the amount of debt that's actually on the books. The other thing is that we did coordinate with the HSCRC to make sure that this would not impact the payments that hospitals get relative to unreimbursed costs. And our understanding from the HSCRC is any impact is nominal or zero on this, and so it won't impact hospitals' ability to get resources in Maryland.
Thank you, Delegate Spiegel. I see the chairman's joined us. Good morning, Madam Chairman.
Thank you.
Good morning. Sorry, I have to have the video off for a minute. I'm multitasking. This is actually, if I may talk to Delegate Spiegel, this is actually a good thing, correct? Like and usually it affects the very poor, and they won't have the debt anymore, correct?
That's right, Madam Chair. And the final version of the two merged bills does contain provisions that require the hospital and or the purchasing entity, whether it's a local government or whether it's a nonprofit, to confirm that the debt they're canceling is for people who I believe are at 500% of the poverty line or lower, or that their debt is so large that it represents a certain significant portion of their income. And so that's exactly right. The idea here is to take away the medical debt that is negatively impacting our disadvantaged and poorer residents, so that they can get more opportunity to grow their own financial opportunities, whether it's on their credit scores, or whether it's access to capital, whether just getting rid of these debts that are hanging over them, that are uncollectible, that we know are uncollectible. So we're not talking about debts that the hospital thinks it can actually recover on, or the market believes are actually recoverable. We're not talking about those debts. We're only talking about the uncollectible portions of these debts.
Okay, thank you,
Yes,
Delegate Spiegel.
thank you so much.
I have a motion and a second. Let me go ahead and move the and get a vote on the amendments. All in favor of the amendments, say aye.
Aye.
Anyone opposed to the amendments? Does someone want to move the amended bill?
Move the bill.
Well, I think Johnson got it.
Second.
As amended.
Okay, we have a motion and a second. Delegate Kipke.
Thank you, Mr. Chairman. I just want to say I would support the nonprofits, but I can't support the government. I don't think it's the role of the government to pay off individuals' medical debt, but I'm fully supportive of nonprofits doing it. So I'm going to be voting against the bill, but for those reasons. Thank you.
Thank you. All in favor of the amended bill, say aye.
Aye.
Anyone aside from Delegate Kipke opposed to the amended bill? Delegate Shalega? Delegate Chisholm? Thank you. We'll move that bill to the full committee. Let's go back to HB 905. When we're back with Aaron.
This bill was discussed in the last week in subcommittee. There were amendments provided, and I believe the Hospital Association asked for more time to review the amendments. So I will go over the bill again and the amendments just quickly. The bill requires each hospital to establish and maintain a clinical staffing committee that has equal membership from management and employees. Each staffing committee must develop a clinical staffing plan that establishes the appropriate number of clinicians needed to administer quality healthcare by setting. By January 1st each year, each hospital must implement the plan, assign personnel to each patient care unit in accordance with the plan, and post specified information about the plan. By July 1 each year, each clinical staffing committee must conduct a review of the plan to evaluate the effectiveness of the plan during the immediately preceding year, update the plan to ensure that it continues to be appropriate and effective, and develop a process for receiving, resolving, and tracking complaints related to the plan. Specified individuals may submit a complaint, and the committee must determine by a majority vote whether the complaint has been resolved. And the bill does not apply to state hospitals. In the reprint provided, if you look on, and these are amendments that are being offered by the bill sponsor, who is Delegate White Holland. The reprint on page 3 clarifies that the clinical staff committee member shall include a staff physician who is not a hospital employee or administrator. It strips the very specific language about the clinical staffing committee developing the staffing plan, and it requires that the committee develop a clinical staffing plan that meets patient needs. Then if you look on line 22 of page 3, when developing a clinical staffing plan, the committee must consider existing staffing levels, methods to secure coverage needs as necessary, existing gaps in staffing, how to address the gaps, any available evidence-based standards, and a schedule for periodic review of the plan. The amendments also clarify, and this was a technical amendment, on page 4 of the bill in line 13, that on or before January 1st each year, beginning in 2027, the hospital must implement the clinical staffing plan. That's because the plans aren't required to be adopted until 2026. And then on bill page 5, there is language that strikes the requirement that each hospital would post the clinical staffing plan on their website. And then furthermore, there is a study or a report that's been added on page 5 after line 11 that requires beginning July 1st, 2029, and each July 1st thereafter, the hospital association must compile the reports that are provided to the hospital that summarize how their committee has addressed safe hospital staffing through their plan during the immediately preceding year, and provide the report to the Senate Finance Committee and HGO in a single transmittal.
Thank you, Aaron. Delegate Whiteholland, anything you'd like to say at this point?
Just again, I would like to thank members of the subcommittee who have offered some of these suggestions and recommendations to further strengthen the amendments that are being offered, as well as working collaboratively with Vice Chair Cullison and having her also at the table with both myself and our Senate cross-file to work through this bill. So looking forward to further discussion and welcome any questions that you all may have. Thank you, Mr. Chair.
Thank you. Thank
Can I
you.
move the amendments?
Yeah, let's move the amendments.
Second.
Okay, on the amendments, Delegate Kippy.
Thank you, Mr. Chairman. I apologize if this has already been answered, but I haven't heard it. I heard Aaron say that state hospitals are exempted. Can someone explain why?
Delegate Whiteholland?
Yeah, so I think ultimately there is a difference between our non-acute and acute hospitals. And there is already, and I think I would invite, if our health department is here, they have elevated for us that some of this is what they already do, have already listed in statute, or is what they are already guided by. So they provided us with some guidelines in which they follow related to staffing. And so we did not feel it necessary to include them here. And so I would invite Megan or others to chime in so they can provide the justification if they are available.
Hey, Megan, anything to add here?
Yeah, good morning, folks. I'm here with Sarah. She's going to chime in here.
Yes, and apologies. I was on another call, so our camera system is not showing up. So I think that the big thing is that we do have existing, and apologies, there's a few calls going on at the same time. There is the CMS guidance that we provided, but I think the biggest piece here for us is that the state hospitals really are very functionally different from our private counterparts, particularly when it comes to our patient loads and things like that, and the fact that we don't have the level of flexibility that other hospitals have. Our patients come to us and we must take them on. Hold on one second here. Hold on one second. My apologies. I think there was another call going on and didn't know if I could be heard. But I think that the big piece for us is that our hospitals do have to accept all of our patients and don't have the ability to have kind of the staffing surging that some of our private counterparts have, which does make our state hospitals unique. And we feel is why they should not be included in this bill.
Thank you.
Thank you. I have a motion and a second on the amendments. All in favor of the amendments, say aye. Opposition to the amendments? No opposition to the amendments. Does someone
Move the
want
bill
to
as
move?
amended.
Second.
Okay, we have a bill that's been moved and seconded. Delegate Chisholm?
I know the Maryland Hospital Association had comments last week. Have they been resolved? I feel like from what I just told, the state hospitals already do this, but I've also heard that many of our private hospitals are already doing the same thing. Can somebody address that for me? I don't know if
Okay,
Andrew can-
yeah, Andrew, Nicholas had said last week he hadn't had a chance to see the reprint, so we gave MHA a couple of days to review the reprint. So let's hear from Andrew.
Thank you, Delegate Kerr, and thank you, Delegate Chisholm, for the question. So MHA, we remain opposed to the bill. Appreciate the efforts of the sponsor and the advocates and the committee on addressing some of the concerns. We continue to feel, that our current practices are guided by the same guidelines. Really, honestly, as I just heard reflected from the state, and I think we face a lot of the same challenges that you would hear from the state as well. But clinical staffing committees just remain really a third rail and not one we're supportive of addressing through legislative means for our members. Additionally, we're at a time when we're facing a lot of uncertainty for hospitals and our entire healthcare continuum of care and healthcare ecosystem at the within the state. And so just we're very wary of legislative mandates at this time while that uncertainty exists, and particularly when it's on critical operations. However, I do want to add we remain committed to shared governance, and so would like to continue to work with the committee on efforts over the interim to develop a shared governance framework, statewide for our members. That's something we're definitely interested in leaning into.
Thank you. Notwithstanding objections from MHA, I'll call for a vote. All in favor of the amended bill, say aye.
Aye.
Opposition to the amended bill. Delegate Kipke, Delegate Chisholm, Delegate Shalega.
Mr. Chair, I'd just like to make a comment if that's okay.
Okay, we still have 7 bills to go, so if you could do it quickly.
Okay, I just want to say that I know this is a problem and we're all concerned about this shortage and ensuring that all of our healthcare facilities are adequately staffed. But I do find it I don't think it's right that we're holding our hospitals to a different standard than we're holding ourselves. And the state hospitals are having the same challenges. It just is not a good look. So that's why I'm a no.
Thank you. Delegate Kipke.
It was a holdover. Thank you.
Okay, you're welcome. Okay, thank you, everyone. Moving on, HB 106, as I said earlier, is going to be held because the delegate and his advocates have not worked everything out yet. Let's move on to Delegate Harris's other bill, HB 991.
This bill extends the termination date for the Minority Business Enterprise Program by 1 year to July 1st, 2026. Extends the due date, excuse me, for the related disparity study also by 1 year to September 30th, 2025, and makes corresponding adjustments to the termination and due dates for MBE contracting requirements and related disparity analyses under current law. I circulated an amendment that has been voted on in the B&T subcommittee, but not in full committee yet, that has the cross file on this bill. The amendment includes in the bill an extension for the MBE requirements for public-private partnerships and the associated disparity study. And I saw earlier, I think MDOT is here.
Okay, let's go ahead and move the amendments. Motion on the amendment, someone?
Move the amendments.
Second.
Okay, motion and a second on the amendments. Discussion on the amendments. Someone from MDOT have something to say?
Yes. Hi, Matt Michler, Director of Government Affairs for MDOT Secretary's Office. The amendment simply adds in the application of the MBE program to public-private partnerships. It was a provision that was originally in law in 2023 and appears not to have been extended during the last extension of the program at that time.
Thank you. Thanks for being here. I'll call for the vote on the amendments. All in favor of adopting the amendments, say aye. Opposition to adopting the amendments? Seeing none, I'll call for a vote on the amended bill.
Move the bill as amended.
And that's a second from Delegate Taveras. Discussion on the amended bill. All those in favor of the bill as amended, say aye.
Aye.
Opposition to the amended bill. We will move that bill along to the full committee and go on to House Bill 500.
Good morning, Delegate Kerr. This is January McKay for Delegate Harris. Are we passing over HB 106 because it's still being worked on?
Yes.
Okay, thank you for moving HB 991. Greatly appreciate y'all. Have a great day.
Thank you. HB 500, Lindsay.
All right, I'm going to spare everyone the description of the bill and generally speaking, the description of the amendments again. And I'm just going to highlight where the amendments are different from the last time that we talked. So I circulated a reprint on the amendments. On page 12, the amendments authorize the Chief Procurement Officer to adopt other methods of source selection only with the approval of BPW. Previously, that requirement was not attached to that. On pages 19 and 20, the amendments require solicitations for a task order to master contractors to be made on a rotating basis. On page 36, previously included in the amendments was a definition of veteran, but that was that definition was reworked to align with what HGO did on House Bill 448 earlier this session. That was Delegate Kipke's big military bill package that aligns the definition of veteran throughout the code. On pages 42 through 46, previously the amendments were striking the good labor practices preference. And so instead of striking that full section now, the amendments establish a good labor practices evaluation factor of 10%. Rather than establishing a certification process for that, instead, businesses are required to attest via affidavit to the good labor practices that are listed in the bill. The amendments require the commissioner to publish a list of people who have submitted that affidavit for the and applies the joint and several liability aspect of good labor practices only to prevailing wage and living wage requirements in state law. And then on page 47, the amendments decrease under the bill from $1 million to $200,000, the amount of a contract modification that the primary procurement unit, chief procurement officer, or the chief procurement officer's designee may approve that does not otherwise change the scope of work under a contract. So those are the differences from last time we met discussion of the amendments.
Okay, thank you, Lindsay. A motion on the amendments before we go to discussion.
Move the amendments.
And a second.
Second.
Thank you. Okay, we have a motion and a second on the amendments. Delegate Kipke, I recognize you first.
Thank you, Mr. Chairman. When I first considered this bill, I was concerned about that price preference in light of, the Key Bridge, for example, how much that could really be a huge impact, financial impact to the state if we were on the hook for it. But other projects as well could add to the cost of the state responsibility. So with these amendments, practically speaking, if the state were paying for, the construction of a new building or Key Bridge type replacement, specifically, what are we on the hook for financially? How much more could we be paying for something with this amendment?
Lindsay, do you want to take that? Or should I ask one of the bill advocates? Jamie Tomaszewski?
Good morning. I'm happy to answer that question for you, Delegate Kipke. The way the new amendment is written, it is an evaluation criteria on a technical proposal. So the technical evaluation would have this criteria based on the vendors testing to meeting the good labor practices requirements. And so that is an addition to their technical factor. In an RFP, or a request for proposals procurement process, the technical evaluations are done separately from the financial evaluations. So once the financials are opened, they're ranked based on lowest price to highest price. And then there's a merging between the technical evaluation and the financial factors to get an overall award recommendation. So it really does not play into the financial part of it at all with this new change in the amendment.
So is it fair to say that all things being equal financially, somebody gets a more positive look if they also meet this criteria when the next best bidder doesn't?
Correct. I think I understand what you're saying. Yes.
Yes, thank you.
Huh?
Delegate Johnson?
Thank you, Mr. Chairman. I had a question on the W-2 requirements, but I found it in the bill. I see it's still in there, so thank you.
Delegate Johnson, I didn't quite hear your question. Your volume's kind of low. Can you repeat it, please? Or you just muted yourself?
He said he found what he was looking for.
Okay, thank you.
Yeah, I found it. I had a question on the W-2 status, make sure it was still in the bill, but I found it, so thank you.
All right, thank you. Delegate Kaiser.
Thank you, Mr. Chairman. I have two different questions. If I could go with the first one. I heard in the description of the amendments, the part where the BPW was put back, but I was curious whether from the treasurer or comptroller's office, if they were satisfied with overall with the amendments related to the BPW.
Is anyone here from the comptroller's office?
Or
Yes.
treasurer?
Oh, Jasmine.
Yes, happy to jump in here, and thank you for that question, Delegate. So we've dropped all of our issues with the amendments except for expedited procurements. The comptroller is still firmly against the language as is. We're appreciative of all the amendments, but she would want to preserve BPW pre-approval for expedited procurements in light of the 2021 legislation that she voted on and supported that instituted this method and that process. But otherwise, the governor's office has been very receptive.
Okay, thank you. And Mr. Chair, can I ask my second question?
Go ahead.
Delegate Kaiser, sorry, this is Laura from the treasurer's office. Chair, is it okay? Thank you. The treasurer's perspective is just to defer to the subcommittee, but we had sent some separate amendments to committee council, and the only one of the four that made it in was the source selection amendment. So the other three provisions that make changes or pull back BPW authority were not accepted. One is the one that Jasmine just mentioned with expedited procurements. The other is with the contract modifications. And then with the provision that takes away the board's authority to approve canceled solicitations or rejections of all bids. So council has our separate amendments if the subcommittee was inclined, but the treasurer defers to you all.
Oh, thank you, Laura. Thank you, Delegate.
And then my second question, Mr. Chairman.
Yes.
I heard the mention also of joint and several liability and also the way that the labor provisions, I guess now only apply. I didn't hear the full thing to project labor agreements and something else. But the question I had based on the original bill and the 10 qualifications that were in that labor section, my understanding is that 9 of those 10 were already state law. So I wasn't quite sure how that 10-point thing that was described today, how that plays out if it's already law to do all those things.
Brad Fallon.
Yeah, thank you, Mr. Chair, and thank you, Delegate. So there's kind of a two-part to that. The 9 out of 10 are not current law, so there are provisions in there like requiring employees to be paid using a W-2 or requiring them to be paid through payroll rather than cash, or the joint and several liability piece. There are some pieces in there that are existing law. There is, though, a benefit of the certification and the affidavit that is laid out in the bill as amended, in that a big issue here is noncompliance. This adds a secondary stance where somebody is now signed on a contract as a response to a bid or solicitation here. for a contract. And so there's an additional layer of oversight and a different layer in addition to whatever they may already be subject to under the labor and employment law for breaking a contract. So, any contract that a contractor were to enter into with the state, should they break those terms, they might have a notice of cure period, but otherwise they face debarment ultimately, right? They have now broken a contract with the state. So it adds to the compliance section and expands out what those protections for workers are.
Okay, thank you.
Thank you.
Thank you, Delegate Kaiser. Moving on to Delegate Taveras.
I don't know if I'm seeing anyone from the unions. I just want to make sure that they are now satisfied with the re-injection of those pages 42 to 48 and that they're satisfied with the current amendments.
I sent the link to Donna Edwards this morning. I don't know that she joined the call.
Elizabeth Bobo here, Legislative Director for the Maryland State and DC AFL-CIO. We are okay. We've been working very closely with the governor's office to work on these amendments. And so I believe we got to a place where we are all okay with them. Thank you.
Thank you.
And thank you, Elizabeth. Good to see you.
You, Delegate Kerr.
Elizabeth was in Delegate Simpson's office last year. Other discussion. Let's go ahead and vote on the amendments then. I'm sorry, let me back up. I don't recall whether I moved the amendments.
Move the amendments.
Second.
Okay, motion and a second on the amendments. All in favor of the amendments, say aye.
Aye.
Okay, opposition to the amendments. On the bill as amended, do I hear a
Move the bill as
motion?
amended.
Second.
Okay, and bill's been moved and seconded. Delegate Kaiser.
Thank you, Mr. Kerr. Just my second bite of the apple, Laura Addis from the Treasurer's Office mentioned that they had some proposed amendments, and I'd like to hear some discussion of them to understand them a little better.
Okay, would you like to go over them again, Laura, and then we'll hear from
Sure.
the others involved in the discussion?
Thank you, Mr. Chair. Thank you, Delegate Kaiser. So the expedited procurement amendment is on page 14. If you all have the reprint that Lindsay provided, I can sort of talk through. It would essentially, the treasurer's amendment would just restore current law. So that is, that would be the change. Let's see.
But why? I mean, give us the why.
So what this provision of the law says is that the board on the front end of, so with expedited procurements, the Board of Public Works has to approve that as a method of procurement, and then also approve the contract once it comes back and it's gone through that expedited process. So BPW looks at it first to make sure it's appropriate to be treated as an expedited procurement, and then on the back end, make sure that the contract itself is acceptable. What the bill is doing is it's saying that the board would no longer do the pre-approval. That's what Jasmine was mentioning from the comptroller's office. So then the method itself would not be something that the board would approve. And Joanna Kelly, our BPW liaison's on the call, and she could perhaps provide more examples, but I believe twice recently BPW has not approved the method of procurement for this type of item because they felt that it was not appropriate. So that is why the treasurer and the comptroller feel that the board should be able to say whether or not something should be going through the process in that manner.
Thank you. Joanna, do you have something to add? Well, I see you're not muted, but we can't hear you.
Jasmine might be able to provide an example. I think there was a commerce.
Yes, Laura. So there was a recent item from commerce that the board had questions about. We also had a family related expedited procurement that there were questions about the appropriateness of that And both of those items ultimately got pulled from the agenda due to the questions posed from both of our offices. And as you all may recall, this method, the expedited procurement method, came about when something is not an emergency but needs to move faster, and was kind of at the recommendation of DLS in 2021, expanded to be used by all agencies. So we do see, I think we saw 11 last year, and questions do come up about them. And we think the pre-approval method, since that was a recommendation of DLS and passive legislation, maintaining that is a way to keep emergency procurements and expedited procurements used most appropriately. And, there might have been abuse by other administrations, and we're just concerned about that ongoing future.
Thank you, Jasmine. Secretary Chaudhry, would you like to respond to this particular question?
Sure. Thank you, Mr. Chair. Yeah, I think that right now with the amendments, the Chief Procurement Officer would have the capability to review the expedited procurement request, approve it from a technical standpoint, and then it would still be reported back to the board after the procurement's been completed. So I think that's a methodology, and I think the justification reason behind that is to be able to try and move quickly associated with an expedited procurement, where the Chief Procurement Officer can coordinate to make sure that there's policies, procedures in place, and actually certainly can coordinate with BPW liaisons and the Treasurer and Comptroller's Office, and making sure the policies are appropriate. But we want to make sure that we can have agencies move quickly. One of the main complaints that we get from a lot of agencies is the ability to move quickly when there is a justifiable need to do an expedited procurement. And that doesn't necessarily qualify to be an emergency, but would be that. And we would have the procedures and methodologies in place where we could have those checks and balances without waiting for a BPW meeting scheduled, which usually we've got to wait to get on the board schedule. It takes time to do so. So this gives us an opportunity to be able to move swiftly while still having safeguards and still being able to report back to the board on the procurement itself.
Delegate Hill, same topic or different topic?
Same topic.
Okay, go ahead, please.
Yeah, so thank you, Mr. Chair. So what I hear the comptroller and treasurer saying is they want to have a clear distinction between emergency and urgent. What no one's telling us, and it would be helpful to know, is what kind of time frame are we working at currently? So if you have something under the current amendments without taking these additional amendments, how fast would an urgent move? And what would be, if it moved and BPW in retrospect would not have approved it, they don't have any regress, right? There's nothing for them to do except I wish we knew about it. So what's the time lapse that makes this so problematic? Are they making you wait 6 months, or are they making you wait 3 weeks? What's going on here? I think that's for Secretary Chaudhry.
Okay, Secretary Chaudhry, can you answer that?
And I'll defer the technical things to Jamie Tomaszewski. But generally speaking, emergencies are treated a little bit differently because we can move on those basically immediately versus an expedite, which takes a little bit of time. So Jamie, do you want to go through and just talk through what those timelines are so Delegate Hill is able to understand them?
Sure, thank you. Good morning. The emergency procurements are currently approved by the CPO and have a 48-hour turnaround time. So an agency requests an emergency procurement, the CPO reviews it and responds back within 48 hours of approval or not approval so they can move with the emergency. Right now, expedited, the way it's set up, the agency submits a request to the Board of Public Works, which can take 30 days to get on a board agenda from our office to the board to get that approval. And then they can start working on that expedited procurement. If we had the ability to approve that by the CPO, which a lot of times emergency procurements come into our office saying, oh, it's an emergency. And we're like, no, it's not an emergency. It's not to mitigate health, safety, and welfare, but you do have a time constraint that may be subject to using the expedited procurement method, and then tell them to go, get on an agenda to go to the board. If the CPO could then say you can go ahead with an expedited procurement based on this, they could start immediately to be able to post the solicitation and get that award recommendation. So they could still do as much competition as possible, which right now RFPs and IFBs have to be on the street for at least 21 days. They'd still have that 21 days that are spent waiting to get on a board agenda to do that expedited procurement and have that solicitation out on the street for getting.
So if we take the amendments on the expedited that everyone's agreed to, and then we add to it that the final approval still has to come from the board on an expedited, what would that create? I mean, you're already, from what I think you just said, they can start working on an expedited. They've got 21 days. We can have the board put it at a higher priority because it's expedited. So it has to be at the very next board meeting, not 2 or 3 board meetings now. Something like that. Would that work, Ms. Atlas? That your ability to add an expedited procurement to the agenda would be at the next meeting, not 5 meetings down the road or 3 meetings down the road?
I would, Delegate, if it's okay, I need to defer to our BPW liaison because that's getting more into board
Okay.
process.
Let's
I
see.
believe that, yeah.
She's on. Mr. Chair? Ms. Kay.
Okay, Joanna, did you get your microphone fixed? No, we still
No.
can't hear you.
I think I can answer that. So
Jasmine, go ahead.
yes, so the 30-day process that Jamie's speaking to, that's an agency process. Things can be brought to BPW the morning of a meeting, and we meet every 2 to 3 weeks. So that is a procedural thing that DGS would need to speak to, but nothing prohibits them from bringing something with, consent of the board, even the morning of a board meeting. So the 30-day process she's speaking of is an internal to DGS.
So Jamie, is that right? Do you disagree with that statement? That if there was an expedited, that they could get it on the next board meeting?
It can happen, but it's very unlikely because there's a lot of conversation that happens behind the scenes with the liaisons and the Board of Public Works staff to make sure that it's appropriate to even move on to the agenda. I mean, sometimes before it even gets on the agenda, we have the consensus that it's not appropriate to go at this time. So
if
that
we
too could
tested
be the
that, the
reason for
CPO
pushing-
called it expedited, that there's less conversation. If once the CPO deems it to be expedited, if we take away the conversation, that they get to make the determination and the board has to respect their determination. If we did that, would that resolve both sides of that?
So you're saying the CPO is still making the recommendation for it to be an expedited, and then it comes to the board for approval of that award?
Yeah, I have a problem not having the board approve it. Emergency, fine, but just looking at an expedited and going, gee, I wish we'd known about that, we would have viewed it differently, is a little problematic. But I hear you want to move it quickly.
Got it. Yes, that makes sense. I appreciate that. And I think part of it is too that even with emergency procurements and the current process for expedited, those contracts are awarded to get in place quickly, and the board has the ability to remand and cancel those contracts. So we still have the ability, the way they're currently structured and the way the bill is structured, to have the board cancel those contracts and not
That's
move
my
forward.
recommendation, Mr. Chair. I don't know if it meets the comptroller and the treasurer and procurement secretaries, but I'm just uncomfortable not treating expedited with some need of approval.
Secretary Chaudhry?
Thank you, Mr. Chair and Delegate Hill. I think part of the issue here is as we're trying to move forward in a methodical process. BPW process usually takes a little bit of time, and the reason is, I think Jamie mentioned it, there are pre-meetings. There are pre-meetings with the board staff to get them up to speed on what the issues are, then time for comments and questions, and then there is some back and forth there. So I think our thought was to be able to have a methodology in place to coordinate, to have it structured, because these are usually really technical requirements, right? Does it meet the justification of expedited procurement or not? And given the CPO the capability to do that, we're happy to coordinate with the treasurer and the comptroller's offices offline to make sure that those requirements meet their needs. And then we can maybe even maybe even have the capability where we can, where right now there's a reporting to the board, you know, sort of after the fact, but what we could do is potentially in lieu of a, to try and get away from a pre-approval with the board, maybe at least notification to board members that an expedited procurement is.
Or what about that
underway.
what about they can individually, without having to meet as a board, that they can sign off, but you need 2 out of the 3, all 3 have to be notified and 2 of them have to sign off. How do we get a sign off from them? Not just we heard about it, but we heard about it, we asked our questions and we signed off.
I think that might, I think they would have to meet the Public Meetings Act. So I think they would still have to meet to vote on something like that. Jamie, you have your hand raised.
Well, I'm just trying to clarify, are we talking about the usage of the procurement method or the awarding of the contract? Because the way the language is written, the award of the contract is still coming back to the board for the board to approve that final action.
Ms. Atlas or Ms. Clemens?
Yeah, Delegate Hill, if I understood you correctly, you were saying that you were wanting to make sure the board was pre-approving this as a method of procurement. Is that correct?
Yes, I'm trying to get to the amendments that you guys say are important.
Yeah, that is what not to speak for the comptroller, and perhaps Jasmine, correct me if I'm wrong, but the treasurer and comptroller are in agreement that they believe the board should retain its ability to say whether or not something should be treated as an expedited procurement. So they would prefer current law to remain in place, which is what the amendments that I provided to council would do.
And Jamie, how does that affect your processes, the current method, as opposed to what you're proposing in this legislation?
It puts us going to the Board of Public Works twice, once for recommendation for the procurement method itself and once for the award of the contract. And so we're asking the front end to be done by the CPO so that it you know, the threshold for approving the emergency procurement method is higher than the threshold for expedited, yet the CPO has that authority to do the emergency, but not the authority to do the expedited. So we're asking for that same authority on the front end for usage of the procurement method, but then the board would have the ability to approve on the back end as it does now.
Delegate Hill?
Yeah, I mean, it makes sense to me as long as the approval has to come through, but Ms. Clemens and Ms. Atlas keep saying that that's not what that language does. That's why I'm confused. Because what Jamie explains makes sense. Let the CPO and the process start. It's going to take 21 days anyway. They can at least start the process occasionally. If the CPO is wrong, the BPW will say, nope, we didn't see it that way. You're going to have to go back and do more work on it. But most of the time, they're saying if they have a reliable CPO and clear rules that they have to follow that define what justifies an expedited process, by the time they get it, they can sign off on it and say, yep, and then it can get actualized. So I'm not sure if the BPW still has sign off authority, why the objection to at least getting the process started? And that's for Ms. Clemens and Ms. Atlas.
If I can, so if you look at the bill, page 14, it's in section 3106, subsection D. You can see that board is being bracketed out. So it takes out the provisions where the board can approve something on an expedited basis. So it's taking out the front end approval. I don't think there's any, I think everyone's on the same page at the agency level that that's what the bill is doing there. But it's just a question, a policy call for you all, whether you want the board to be approving the method or not.
Mr. Secretary?
Thank you, Mr. Chair. And I'll go back to sort of the intent of this Procurement Reform Act. It's to streamline procurement operations across the state. That's the intent. It's to give our procurement officers under the authority of the Chief Procurement Officer more tools in their tool belt to be able to move procurements along in a more expeditious fashion. And you know, a lot of these things are very, very technical. We think going back to the board and reporting and giving them a sign off still gets board approval, but at least there's an opportunity to move things along faster. And you know, with all the regulations and laws in place when it comes to procurement, Mr. Chair, as you're well aware, being an expert in this field, there's all these nuances and challenges. So we're just giving more tools to the toolbox to our procurement team to be able to move quickly into agencies, because that is our number one complaint is agencies want to be able to get their goods and services faster, and sometimes they lose out on funding because they're not able to move as quickly as they need to be able to, or there's challenges with being able to provide services.
Jasmine?
Thank you. And I just wanted to have a note because we're talking about the pre-approval and when it comes back. So, you know, as Laura was saying, our office's preference is to keep the current process. And from our opinion, it's working as needed. So as we've stated, they bring the pre-approval, they go out and do the procurement, and they bring a report back of the award. We don't even approve the actual contract. We get a report about it. And so the board has ceded that extra or normal approval process because we understand it does need to move faster. So you don't need to wait to bring it back if we've already pre-approved it. So the process as is does try to speed up things, and nothing precludes the agencies from doing any preliminary work, as we understand it, to get the procurement ready to go after pre-approval from the board. But you know, the comptroller feels that the process is working as intended. I think last year there were 10 expedited procurements and only one was withdrawn. And I think we only got 4 reports of completed procurements. So these are not something that's super frequent, but we take a lot of, like they're saying, there are a lot of conversations about the appropriateness of it, and they have the right to go and execute the contract afterward before coming back to the board. So, you know, it is sped up on the back end. It's just the pre-approval that we feel is necessary to ensure that it's not being, it's being used appropriately.
So you don't think that the CPO should be able to determine with guidelines that you guys have agreed to what qualifies as an expedited contract and then move forward on it? That you want them to ask you, is it okay if we treat this as an expedited contract?
Yes, the current process where we look at it case by case, and there are unique factors with every single one of them. We've seen a lot and they've all been so different. And, you know, we have tough conversations sometimes when they come and we disagree on the appropriateness, which is, you know, this is why they brought it, because they think it's appropriate. And occasionally the board has said, actually, we don't agree. So
most of the time you all are in agreement that the CPO's judgment is correct.
Correct.
So
most of the time,
as I understand it, they're asking for some better defining parameters. So, okay.
So, Jamie, we heard from Ms. Clemens how the process is intended to work. Is that your experience that it's working that way?
With the board pre-approving and then reporting afterwards?
Yeah, is it? Well, Ms. Clemens was alluding to that this is not it's not a problem. We're trying to fix a problem that doesn't exist.
Well, it can be a problem, and we've seen where it's gotten sticky with the timing of being able to actually conduct a procurement because the agency is losing time on the front end to actually get competition. So the shorter time frame that we give vendors to respond to a solicitation, the less competition we get. And so if we can have the front end in order to get the solicitation out on the street in a faster timing, we get those extra days to have the solicitation on the street and get more competition. And that's the ultimate goal. So streamlining the front end, the CPO has authority to approve an emergency. Why not allow them to approve an expedited procurement method so that the agencies can get that procurement on the street, have the time for the procurement process itself, which is where we want to make sure we're getting as much competition and as many contractors responding so that we get better pricing through that competition and not be forced to take higher prices because we've got a shorter window now to get vendors to respond and their ability to respond is, they're now tied up in other projects because we didn't have it on the street 30 days ago.
Mr. Chair, if I may,
Yeah, Delegate Hill.
Thank you, Ms. Clemens. It would seem to me that if you all tighten up, you said there are a few times you disagree, if you tighten up the criteria by which the CPO can deem it to be expedited, and you still find that there are significant times where the CPO has said it's expedited and the BPW does not agree at the end point, that in and of itself, nobody wants to go through all that work and then have it overturned. So I think that if you're not aligned a significant amount of time, they're going to stop doing expedited. So why can't we allow it to just roll out where the CPO deems it expedited? Your offices come in a little bit tighter about what qualifies. When what your arguments have been when they said it qualified, but it really didn't. And then see how that plays out. Again, because if they've moved forward and you guys are saying no at the end, then they've wasted a lot of time. And that should be a deterrent to continuing to approve things that you're ultimately not going to agree to.
Yes, I'm happy to take this discussion back to the comptroller to see where she feels, if she thinks this is something that could be rectified with, I guess, policies and procedures, just as is with the language and the process we have now. That's why she's unsupportive of the language. And she pointed back to the 2021 audit of the expedited and emergency procurements and that legislation. So I'm happy to take this back to her and have another discussion to see if there's a policy way to solve this. As we've originally discussed it, just the language of the law doesn't seem to be enough.
Okay, let's move on. Delegate Kaiser.
Thank you, Mr. Chairman. I had a few questions, but Dr. Hill's questions were much smarter than mine, and it sounds like we may have gotten to a different resolution with that. So I'm okay too. I guess I had one question when I heard the Department of General Services say part of the problem is that the BPW doesn't immediately put something on their agenda when it's expedited. Is that not an option to do, to make it that if it's not put on the next agenda, then they don't get that chance to review it? I mean, is there a way to add that in?
Who's your question for?
So I'm not even sure anymore. Maybe Miss Addis, maybe Miss Clemens, but just if it had to go on BPW immediately, because that seemed to be the challenge that Jamie was saying with BPW, is that it doesn't immediately go on the next agenda. So just trying to understand that part of it.
Ms. Clemens?
I can speak from a liaison point of view. It is possible to bring items to the next agenda. Jamie spoke to, they have preparation and paperwork that they're in that makes it take longer. But as a board, we are amenable to hand-carried items all the time, which happens not so infrequently.
With Delegate Kaiser, if I may, I think what she's suggesting is that we put language in there saying that the CPO deems it expedited, ask for it to be put on the next agenda, and it's not, that it is, that the fact that it wasn't is de facto that it is, right? Either you consider it or it's presumed to be expedited and the CPO can move forward. Is that what you were saying, Delegate Kaiser?
Like I said, you always say it better. Thank you, Delegate.
Jamie, your response?
Well, I was just going to add that the other challenge is the Board of Public Works meets every 2 weeks on average, right? In the summer, it's about 3 weeks apart. So even if we got it on the next agenda, at sometimes you're talking about a 3-week delay. So that's part of the reason for allowing the CPO to approve the front end to get the procurement process started.
But
so
I
we're
thought
not
that's what was
waiting.
already I'm sorry for interrupting. I thought that's what already was going. We've had testimony that you guys are already starting the process.
No, we don't. Right now, the current process is nothing happens until the item comes to the Board of Public Works for approval of the expedited procurement method. So that's where I say we've lost potentially 2 to 3 weeks if we're just going for the next board agenda, let alone internal review processes and things like that. So that's why I said up to 30 days. before we get on agenda for that approval process of the method and then doing the procurement. So this, we're asking the CPO to approve the method, and then the agency can go on with the procurement process itself, and then we come back to the board with the award.
So best case scenario under the current system, it could take 2 or 3 additional weeks.
Yes.
Okay, Delegate Johnson.
Thank you, Mr. Chairman. We've heard a lot about timelines expedited, doing it faster. So you did 10 of them last year. So were there any delays? What was the average time of getting those 10 done versus what you think the timeline would be with these changes?
Jamie?
I can speak to one particularly, which was one for the Department of Budget and Management, where the procurement was done as an RFP, but they only had the 30-day window for the solicitation and ended up only getting one response to the solicitation versus having an additional time on the front end that they could have gotten additional vendors to respond to that solicitation. So even doing a competitive procurement, sometimes we only get one response because of the shortened time frame that it's on the street.
So that's one case. How about the other 9?
Because they're done by the agencies themselves, I don't know all the details as to what the process happened for those particular cases, but I was working very closely with the procurement officer on that one.
All right, thank you. Thank you, Mr. Chairman.
And Delegate, I think just to clarify there, I think it's some of those instances, it took several weeks because if they came in normal order, Jamie, correct me if I'm wrong here, that we've got to draft agenda items and get them submitted, to go through all the approval processes, probably somewhere in the neighborhood of 4 to 6 weeks in advance of the agenda. So it was recognized as an expedited procurement. We have to wait, 4 to 6 weeks at that time to go through the process to get on the agenda. Go through the agenda to get the approval and then move forward on actually doing the procurement itself.
Thank you, Mr. Secretary.
Delegate Hill.
Yeah, Mr. Chair, I'm glad that all this work's been done on this bill, but as the treasurer testified, that's our voice as legislators, and I feel there ought to be a better level of comfort about the expedited process. And if we're going to be meeting again, I would ask that we not move any further with this bill until the department, the treasurer, and the comptroller's offices have come up with a way to achieve the goal for expedited that they can agree to.
Well, let me check in with Brad Fallon from the governor's office.
Yeah, thank you, Doug Kerr and Delegate Hill. We've had extensive conversations with the comptroller and treasurer on this and appreciate them all coming to the table. I think we agreed to 10 or so other amendments on BPW authority so we can hear the point that they're coming from. This is, after 5 or so meetings, I think probably where we come to a head. So our preference would be if the subcommittee is uncomfortable with that section, we would rather just keep current law and keep the bill moving forward because I'm not sure that at this point, after so much discussion, that we're going to find an alternative path.
Delegate Hill, you satisfied with that answer?
I again, what do the treasurer and comptroller say, and what does the committee say? I mean, or else we fix it ourselves. We look at the amendments and we fix it ourselves, and that's up to you, Mr. Chair.
Okay. Laura, Addis, or Jasmine, do you have a response to the governor's office?
We do appreciate all the time that the administration has spent working with the treasurer and the comptroller. I think from our perspective, there were 4 BPW authority provisions, and of those 4, the only one that was accepted was source selection. So, I think the expedited procurement is important, but it's up to the legislature whether they're comfortable deferring their authority in this manner.
Jasmine?
Yes, and to Brad's suggestion that we keep current law, the comptroller's office is okay with that because the comptroller, that's actually what the comptroller wants. So we agree with keeping current law.
Lindsay, do you have the part in the bill that we're discussing and the proposed change?
Yeah, well, the proposed change would be to strike
Current
the
law.
portions of the bill that are, that would change current law and make it go back to the way current law is currently written, right?
Okay. Secretary Chaudhry?
I think I'd be remiss if I didn't just at least put this out there as maybe as a compromise, where there may be something where you could compromise. So I put something in there where, which is not in there currently, where the Board of Public Works would promulgate regulations associated with that, where, any tightening of the guidelines for the expedited procurement approval would be required to be put in regulations. And those regulations are governed by the Board of Public Works. So that way the stipulations for CPO approval would be as tight as the treasurer and comptroller would like them to be, because they would be coordinating hand-in-hand drafting with the governor's office and DGS on those regulations.
Delegate Kaiser?
Thank you, Mr. Chair. I was hearing an issue regarding timing. This is the governor's bill. There is no crossover for governor's bills. The timeline, if there's something to be solved, we can work on it. So we're not stuck with the timeline in front of us. That's all. So I like what Terry was suggesting. Thank you.
Okay. Secretary, is that a leftover hand?
Yes, sir. My apologies.
Okay, thank you. All right, the proposal on the floor is to remove the changes to that provision of the bill and maintain existing law, but then move ahead with the rest of the bill. Does someone want to move that?
I'll move the amendment.
Second.
Okay.
Move that change.
And Lindsay, you know what we're talking about, correct?
I believe so. I'll make sure to update the amendment and send it out to everybody so that that captures what everyone's hoping for.
Okay. All right. We have a motion and a second on this amendment that changes back to existing law. All in favor of adopting this, say aye.
Aye.
Opposition to this amendment? Okay, now,
Move the bill as amended.
all right, moving the bill as amended.
Second.
Second. All in favor of the amended bill, say aye.
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 Opposition to the amended bill? Okay, thank you, everyone. I think that that was very substantive discussion and came to a reasonable compromise. So I appreciate everyone's participation and the work you put into this. Let's move on to House Bill 826.
This one is a departmental bill that repeals the Interdepartmental Advisory Committee on Small Minority and Women Business Affairs. It's a bill from GOSBA, but I know that they have had some discussions with the Department of Disabilities as well on a potential amendment that was suggested in testimony. I don't know if I see.
I'm here representing Deputy Secretary Ann Blackfield. I'm Jade Garrick with the Maryland Department of Disabilities. And the amendment is really to clean up some outdated language. It's just a technical change. Currently, the bill, the language reads as sheltered workshops. Maryland has eliminated sheltered workshops. We're the second state in the country to do that, and replaces it with language that actually appears elsewhere in statute. So it's just aligning it with existing language, referring to nonprofits that support individuals with disabilities. So it's just merely a technical amendment to clean up some language.
Hey, thank you. Davon?
Yep, Davon Gardner from the Governor's Office, Small Minority and Women's Business Affairs. As the Special Secretary testified, we are okay and we concur with the amendment, and we're
Thank you.
good.
Do I have a motion on the amendment?
Move the amendment.
Second.
Okay, a motion and a second on the amendment. Any discussion? Seeing none, I'll call for a vote. All in favor of adopting the amendment, say aye.
Aye.
Any opposition to the amendments?
Move the bill as amended.
Second.
I have a motion and a second. Discussion? Seeing none, I'll call for a vote on the amended bill. All in favor, say aye.
Aye.
All opposed? No one is opposed. The bill moves forward unanimously. 761.
This bill comes from the Comptroller's Office. It makes numerous changes to the Maryland Uniform Disposition of Abandoned Property Act, which governs the distribution of abandoned property in the state. The bill explicitly applies the requirements of the act to additional forms of property, such as virtual currency, establishes various new requirements and procedures related to abandoned property claims, and authorizes the comptroller to retain additional proceeds from the sale of abandoned property for use for certain purposes. The amendments on the bill circulated from the comptroller define gift card and gift certificate, strikes language that would have provided that if an insured dies or the insured or beneficiary of an insurance policy otherwise becomes entitled to the proceeds before depletion of the cash surrender value of the policy, or other non-forfeiture provision contained in the policy, then the operation of the provision does not prevent the policy from maturing or terminating. It alters the value, the amendments alter the value at which the comptroller is required to publish notice from $100 to $50, and it removes certain dollar thresholds being added in the bill that related to offsetting of unclaimed property.
Thank you. Matthew Dudzik.
Thank you. So I'm happy to just briefly discuss the amendments. Most of these are just clarifying amendments. The gift card and gift certificate language is fairly self-explanatory. The insurance provision that's being struck, that had originally come in as a best practice recommendation from the national group, the National Group of Unclaimed Property, which I believe Hesh is on as well, who he can speak to that a little bit. But we'd had some discussions with the Maryland Insurance Administration. They believe it is unnecessary because it would be a violation for the insurer to continue drawing down these accounts after the death of the insured, and therefore they believe that it would be more appropriate to just refer these to MIA. So based on those discussions, we agreed to strike that language. The remaining changes regarding thresholds, one of them relates to a recommendation that we've received from, I don't recall the name of the body, perhaps, as I said, I know Hesh is on, he may have that, but it just means that we're doing more reporting of these smaller claims. And then regarding the offset thresholds, we don't actually have that offset threshold tracked anywhere on our end. So it would be, having this $100 threshold for these it would introduce an operational complexity that doesn't really bring any benefit. So we just are removing those, the recommendation of including those thresholds. Happy to go into more detail, but that I think covers all of them.
Yes, thank you for the explanation. Does someone want to move the amendments?
Move the amendments.
Second.
Okay. Discussion on the amendments. Delegate Chisholm.
I know we're pushed for time, but I am very curious. Has the comptroller received crypto? I only ask that because it's very difficult to open crypto to find out who it belongs to because it's all based off of an algorithm. I'm just curious on why it's in the bill. Have we been receiving?
Matthew?
I'm going to actually ask Hesh to answer that. He's the director of our Unclaimed Property Division, and he would have more specific information.
Yes, thank you very much, Delegate Chisholm, for that. If I apologize if I mispronounced the name there. Regarding crypto, crypto is a new asset class that the countries now, other administrators across the country are seeing coming to the forefront in terms of being reportable. As of date, a handful of states have received crypto. Maryland has already. We have a miscellaneous statute in place that our OAG has blessed with to say we can go ahead and start accepting crypto. However, 10 years ago, there was legislation that was introduced by the Uniform Law Commission. Say, hey, this is what you can incorporate in your state as a uniform method to start accepting crypto. So to answer your question, yes, we just recently starting to accept crypto.
Okay.
But the format is in cash, by the way. The company itself has agreed to liquidate the crypto because they already have the infrastructure in place, liquidate the crypto and remit cash directly to the state.
That makes sense now.
Yeah.
Okay.
And
Perfect.
that's okay.
Thanks
Thank
for
you.
the question, Delegate Chisholm. I had the same one. I have a motion and a second on the amendments. All in favor of adopting the amendments, say aye. Any opposition to adopting the amendments? The amendments have been adopted. On the bill as amended?
Move the bills amended.
Aye.
Okay.
Second.
Motion and a second on the bill as amended. Any further discussion? Seeing none, I'll call for a vote. All in favor of the amended bill, say aye. Any opposition to the amended bill? We will move that bill along to the full committee. House Bill 807, Lindsay.
This is a do-it departmental bill that generally codifies an executive order that establishes the Office of Enterprise Data and the position of the State Chief Data Officer within DO-IT and requires each unit of state government to appoint an agency data officer with specified responsibilities. The bill also renames the Council on Open Data to the Council for Open Data Advancement and modifies the council's membership and responsibilities. I circulated an amendment from DO-IT on the bill that corrects a couple of typos.
Motion on the amendment?
Move the amendment.
Second.
Okay, a motion and a second on the amendment. Any discussion? Seeing none, I'll call for a vote on the amendments. All in favor, say aye.
Aye.
Anyone opposed to the amendments? Amendments are adopted. On the amended bill.
Move the bill as amended.
Second.
I have a motion and a second on the amended bill. Discussion? Seeing none. All in favor of the amended bill, say aye. Any opposition to the amended bill? Okay, thank you. 855.
This bill alters the membership of the work group on establishing a science and technology best practices and innovation network by reducing the number of appointees with specific expertise and affiliation. And the bill also maintains the work group for 2 additional years until June 30th, 2027, and extends the deadline for the work group to report its findings and recommendations by 2 years to December 1st, 2026. There are no amendments on this one.
Delegate Hill, you want to move your bill?
Yeah, please move the bill.
Someone want a second, Delegate Hill?
Second.
Okay, motion and a second. Any discussion on the bill? All in favor of House Bill 855, say aye.
Aye.
Okay, any opposition to House Bill 855? Okay, we'll move that one on to the full committee. Final bill of the day, House Bill 822.
This is a proposed constitutional amendment removing numerous references in the Maryland Declaration of Rights that putatively require belief in God. The proposed amendment, in the bill eliminates provisions in Article 36 of the Maryland Declaration of Rights stating that nothing must prohibit or require the making of certain religious expressions in specified public contexts, and repeals Article 39 of the Maryland Declaration of Rights and also makes some gender neutral conforming changes. The sponsor has circulated or has proposed amendments to the bill that I circulate that make 2 changes that I believe she wants to consider separately. The first, the bill originally was striking some language that said nothing shall prohibit or require the making reference to belief in, reliance upon, or invoking the aid of God or a supreme being in any governmental or public document, proceeding, activity, ceremony, school, institution, or place. So that was being struck in the bill, and the amendment would retain that language. And the second is there's language in Article 36 that says that no person should be compelled to frequent or maintain or contribute unless on contract to maintain any place of worship. And that amendment would struck the unless on contract language.
And those were to be taken up separately?
Please.
Okay.
So can I move the first amendment, the
Yeah.
striking of 25 through 27? I mean, striking the brackets of 25 through 27.
Okay. We have a motion on amendment number 1.
Second.
All right.
Second.
All right, discussion on amendment number 1. All right, I don't see anyone. All in favor of adopting amendment number 1? Oh, Delegate Shalega, is this a discussion on amendment 1?
Yeah, sorry, I was slow getting my hand up.
Okay,
Can
go
you
ahead.
explain that again to me? What is this amendment doing?
Right. Okay. So if I may, Mr. Chair?
Yes, please go ahead.
Okay. So as I introduced the bill, it would have taken out this section that says nothing shall prohibit or require the making reference to belief in. And I took that out because, you know, it's you can't do it or you can't, but and rereading the bill and in discussion, I think that part is actually what establishes religious freedom in our Constitution. And it does say you can't prohibit it. I mean, the state cannot prohibit or require. So I think it is that it actually establishes the religious freedom, and it would be better to keep it in there than to remove it.
So that's that extra paragraph below.
Yes. So
Okay.
right.
All right.
And so the bill would
You're
have
restoring
stricken it.
that.
I'm restoring it.
Okay. Thank you.
Does this amend the Constitution?
Yes.
All right. That seems pretty big. So let's go ahead and talk about this a little bit, but I'm not going to take any votes today. So I know we've moved and seconded amendment number 1, but I'm not going to call for a vote. Let's move on to amendment number 2 and discuss that some.
So amendment number 2, let me read up in Article 36. If you look at line 18, after the semicolon, it reads, no, the current law reads, nor ought any person be compelled, and by compelled, it means by the state, right? So be compelled by the state to frequent or maintain or contribute unless under contract to maintain any place of worship or any ministry. And that unless under contract, I had proposed we remove because trying to understand what unless under contract would have meant at the time this was written, it seemed that under contract was referencing enslavement, maybe even a marriage contract. But it was suggested that it's saying unless you have a contract that you have to contribute or unless you have a contract that you have to maintain. So I'm asking for the AG to weigh in if it read instead, nor ought any person be compelled to frequent, comma, or maintain, comma, or contribute, comma, unless under contract to maintain without the contract, comma, without the comma after contract and to, then that would read clearly to me that it's saying if you have a contract to maintain, you have a contract to maintain, but I think there's some ambiguity there. And I was concerned about what that meant. So my original suggestion was to remove the phrase unless under contract, but I'm trying to find out from the AG if it makes more sense to say to remove the comma. So it would read unless under contract to maintain. But that's, and you know, if we're going to do this, which I think it's really important to do, I want to make sure that, you know, I'm not asking us to do something that has unintended consequences and could cause harm. So it's the unless under contract and whether it should be retained without a comma, so it's a contract to maintain, or whether it should be removed completely. So open to feedback and discussion, Mr. Chair.
Thank you. Any questions for Delegate Hill on this second amendment? All right, let's take the bill as a whole. Does anyone here to discuss this bill? Delegate Chisholm.
I'm still trying to understand the impetus of the bill because, you know, from what I've read, in 1961, the Supreme Court ruled that Maryland's constitutional requirement for public officials to declare belief in God was unconstitutional, violating the First Amendment. And it says clearly, that all of this, it's unenforceable anyway. What are we hoping to accomplish with the bill, just to put it in statute?
Sure. So Delegate Chisholm, I think it's a great question. And the answer is we have a shifting judicial landscape where things that we thought and have been longstanding considered to be unconstitutional, we're now being told are constitutional. And that's not really new, right? I mean, we had, separate but equal, which stood as constitutional forever until it was decided it wasn't constitutional. But we also have a tendency to put things back on the state and to say that the state constitution will be supreme. And I think we've been pretty clear about the fact that we don't do religious tests and we don't consider a belief in God to be a criteria for whether someone has enough ethical value to serve on juries or to serve in any role. So we've been pretty consistent with that. And I think that our Constitution should reflect that. Number one, because it should, right? It's not just a Constitution, it's our Constitution. But number two, I'm not as comfortable as I would have been. And again, I introduced this bill 3 or 4 years ago before the current climate. I just think you don't leave stuff in your Constitution that you're not enforcing and just hope, and because I think it can blow up on you one day because you left it there.
Okay, thank you.
Delegate Kaiser?
Thank you, Mr. Chairman. I just want to confirm, Delegate Hill and maybe Mr. Chairman, during the discussion during the hearing, there was a question of God being removed in our state constitution. And I just want to clarify, we're removing it simply from the oaths. And like Delegate Chisholm said, it's currently illegal anyway. So is that just the case? We are only removing them from oaths?
Well, it's from oaths and also from references in the Constitution that basically say that you're, that there's a civic duty to worship God, and that people who worship God are considered to be, have appropriate ethical standards to be witnesses or jurors, but people who don't worship God are not considered competent to be witnesses or jurors. But
So
we do
Delegate
have
Hill,
other
there was
references in the preamble that do continue. So the word God is still in the Constitution. So there are still references to God elsewhere in the Constitution that we're not changing. So it's not just oath.
Okay, and then Delegate Hill, the same day as your hearing, there was another hearing on a bill that people were pointing to the Toleration Act of 1694 as being the strength of Maryland, of our religious freedom, though that religious freedom, of course, was limited only to a few people. But in some sense, you are supporting that Religious Toleration Act of religious freedom here.
Without supporting that bill, yes.
Thank you, Delegate Hill.
Okay, just for my own edification, I'm going to hold the bill because I think it has much broader implications than at first glance. So let's go ahead and continue some of these discussions offline, but I will call on Delegate Shalega first.
Thank you. Can we get a reprint, or was it provided with all of Delegate Hill's suggested amendments to
I'll
our
send
bill?
it to Lindsay. I'll send one to Lindsay to send out.
Sure. Thank you.
Okay. Any further discussion before I adjourn the meeting? All right, seeing no further discussion, let's adjourn for the day, and I'm sure we'll be meeting again this week as crossover quickly approaches. Okay, with that, we are adjourned.
See you in 10 minutes or 20 minutes.
All right, so there's less urgency because the bill's been held?